Hello, my name is Charlotte Wilton and I'm the maternity matron here at Derriford Hospital. Just wanted to talk to you all about some of the concerns that you may have regarding coronavirus and the COVID-19 outbreak at this point. Obviously, at the time that many of you will have become pregnant, you wouldn't have anticipated having to deal with this, and so of course we understand that this is a time of high anxiety. So whether you are just pregnant, whether you're in the latter stages of your pregnancy journey, or whether you've recently had a baby, I'm hoping that some of this advice will be of help. Following the announcement from the government on Tuesday evening, we've had to review our maternity visiting restrictions across our antenatal care, for routine antenatal care, for scans and for any postnatal appointments. And unfortunately, we know how disappointed you will feel, but we have had to take the decision at this time that you attend these appointments unaccompanied. Obviously, if someone transports you to the appointment, they're welcome to wait in the car while you come in for your appointment, but we ask for your understanding at this time to try and protect our staff, yourselves, the families and babies that we're caring for. Obviously, the government advice is being updated regularly, and so we will update you as soon as we have any further details by telephone if there is any change to your appointments. Thank you for your understanding during these unprecedented times. Our plans at the moment are to continue with routine antenatal care within the community, so providing you are well, we would absolutely anticipate that those appointments continue. What may well change are the venues where your appointments are going to be, and so it's really important that we have an up-to-date contact number for you. So if you do not think that we've got an up-to-date contact number, please do contact maternity reception on the number that will be on the front of your notes. If at any point you have any symptoms, so you have a new persistent cough or you have a raised temperature, it's really important that you do not attend any routine appointments. The Royal College of Obstetricians and Gynaecologists are absolutely clear that routine appointments can wait for a couple of weeks, and the midwife will be in touch to rearrange at a point that you are out of self-isolation. If you have a routine scan booked, we plan to continue with routine scans at this moment in time, so that will be your 12-week dating scan and your 18 to 20-week anomaly scan. We will absolutely plan to continue doing those appointments. You may find that there is a change to the number of growth scans that we're actually undertaking. For any appointment that can be done by telephone with a consultant, if you're diabetic, if you're epileptic, or you have any other comorbidity, those appointments may well be undertaken by telephone if appropriate. If not, then we will continue to see people face to face. If you think you've got any symptoms, again, phone the number for antenatal clinic that will be on the letter that comes out with your scan appointment to arrange to delay that, and we'll book you in at a time that suits you. When you come in to have your baby, you're able to bring one person in with you of your choice who will be able to be with you throughout your whole birthing experience. At the point that you phone into the advice line, which you can see here on the front of your antenatal notes is the telephone number, at the point that you phone into that number, you will be asked whether you've had a new or persistent cough or a raised temperature. If you have, it's really important that you let us know, because we will make sure that you will enter the labour ward through another entrance, and a member of staff will come to meet you. We'll ask you to wait in the car at that time. If you've arrived by car, they will ask you to wait in that car, and then they will come and meet you, and you will enter labour ward through another entrance. If you go up to the ward, we're asking that only your birthing partner is present, the person that you chose to have during your labour, and that you don't have other visitors at this time, just to protect yourself, your baby, and everyone else. On arriving home, once we've discharged you, we would hope that your routine care would continue as normal. So that would be a day 3 appointment, a day 5 appointment, and an appointment around day 10 where you'd be discharged. You'll be triaged by telephone the day after you've had your baby. If at any point you feel that you're becoming symptomatic with a high temperature or a persistent cough, or if anyone in your family is, then again we would advise that routine care is delayed, and we will see you at the point that you are feeling better, or members of your family and yourself have stopped self-isolating. At this moment in time, we plan for the home birth service to continue. However, if you are self-isolating because you have symptoms, or a member of your family is self-isolating, we know that the safest place is for you to come and deliver your baby in the hospital environment. So if you've got any concerns at all, please do phone the number that is sitting here, 01752 430 200. That is our maternity line number. It's open 24 hours a day, and they will be able to advise you as the appropriate person to contact. Thank you.